Richmond officials, said they got to over 15,000 people shots in arms last week through regional and local events, and they're rolling out this new mobile method to reach those at risk of the virus.
It's important that we don't take a kind of a free-for-all approach. We want to be very intentional.
Richmond and Henrico Health's Jackie Lawrence describes how they'll approach a new method of getting the COVID-19 vaccine to at-risk groups.
Because when we don't do that, there are folks that end up falling through the cracks.
As mobile vaccination teams will begin visiting independent living facilities this week, not covered by the federal vaccination plan.
We estimate that there are about 50 independent living facilities in our area with about 7,000 residents.
Officials say they're splitting those into three categories. The first are in government housing and on Medicaid.
Some of these folks are as well as being challenged in other areas around transportation access, technology, and have a difficult time social distancing.
The second group is those on Medicare, followed by those with adequate insurance. Officials say they're also continuing their other vaccination events, including regional ones as supply allows, noting the promised increase from the federal government didn't materialize in this week's shipment. They add they continue to try to improve their sign-up methods for the wait list, including adding confirmation emails and some community outreach to help those who may have technology issues.
Be that on-the-ground presence to help folks, because we're hearing that almost daily.
And starting Tuesday, officials say they're switching to a new system for people to register for their appointments and are reaching out to those who need to book their second shot.
But if you haven't heard about a second dose and it's within 7 days of you needing to get that second dose appointment, please email us and we will follow up with you.
And one other thing regarding sign-up, officials want to remind people that if you have signed up for the wait list, to check your emails and voicemails for messages letting you know about upcoming clinics, saying that if they don't get you after one email and 2 calls, they move on to the next person. But I want to remind you, you're not removed from the list if you are missed.